So in this study, we used the US birth certificate data, and our outcome was a binary measure of labor after cesarean access in each county each year. And it was defined as at least one hospital offering labor after cesarean access. And we then examined county level trends in labor after cesarean across the US in the continental US from 2016 to 2021. So we found overall 15.9% of US counties had labor after cesarean access across the continental US over the study period. Metro counties were more likely to have labor after cesarean access than non-metro counties. And over the study period, higher proportions of counties in the Northeast and West regions of the US had labor after cesarean access than in the South and the Midwest regions. Further, labor after cesarean access did not vary across years. We also conducted a subgroup analysis limiting to counties with an obstetric hospital. And among counties with a hospital-based obstetric services, only 30.9% had labor after cesarean access, and results were similar to the main analysis that labor after cesarean access did not vary across years. So birthing people with a prior cesarean face barriers in accessing labor after cesarean services in the US, and our analysis builds upon prior research demonstrating limited access to labor after cesarean services among birthing people with a prior cesarean. We found that fewer than 16% offered labor after cesarean access across the study period. Additionally, counties offering labor after cesarean access are unevenly distributed by region, with more labor after cesarean offering counties in the Northeast region versus like the South region. We found limited but stable labor after cesarean availability overall, and when limiting to counties with obstetric services, despite increases in vaginal birth after cesarean rates between 2011 and 2021. So despite the US VBAC rate slightly increasing in recent years, the results suggest that labor after cesarean has become more concentrated in a smaller set of hospitals or clinicians that are increasing their labor after cesarean and VBAC rates. Further, my findings confirm this difficulty birthing people have expressed in accessing LAC services. Overall, access is not expanding, at least at the county level. So in the US, every year, many individuals approach their next pregnancy already having at least one previous cesarean birth. So understanding pregnant people's labor after cesarean geographic access is essential to improving quality of pregnancy-related care, the birth experience, and birth outcomes in the US. So we know in the US we have a stably high cesarean rate, and has this stably high cesarean rate has the potential to increase the incidence of adverse pregnancy outcomes such as placenta previa, accreta, and maternal morbidity and mortality. And so one mechanism to reduce this high cesarean rate is by increasing the VBAC rate, which ultimately we will need to expand the VBAC access and LAC access. Even with the well-documented risks associated with repeat cesarean, as we see in the findings, many birthing people do not have a choice about their subsequent delivery mode after a prior cesarean. So it is essential to then identify strategies that provide all birthing people the option to attempt a vaginal birth. And ultimately, LAC access preserves pregnant people's choice about method of delivery in their next pregnancies and potentially improve long-term obstetric outcomes. Yeah, so we know like many clinicians and hospitals do not offer labor after cesarean services due to changes in clinical practice guidelines and liability concerns. So many clinicians and hospitals do not have this option of labor after cesarean or VBAC. We know that the clinical guidelines have become somewhat more encouraging of labor after cesarean, which was around 2010. And the American College of Obstetricians and Gynecologists says that vaginal birth after cesarean is a reasonable option for most people with a prior cesarean. So further, for many people, there might be a clinical benefit and better outcomes to having a VBAC. So it should be an option that more pregnant people with the prior cesarean. Yet there seems to be this lag in access catching up with this. And one of the main concerns for clinicians and hospitals is around liability. If there is someone attempting a vaginal birth after cesarean and it ends in a negative outcome. So another thing is typically planned repeat cesarean is more convenient for the clinician and the hospital, as there's also less time laboring. So overall, after all said and done, my advice is that clinicians need to talk to their hospital about changing their hospital policy around vaginal birth after cesarean to be more encouraging of labor after cesarean.